Pertussis is commonly known as whooping cough, which is a highly contagious infectious disease of the lungs and throat caused by Bordetella pertussis bacteria. The World Health Organization estimates that in 2008, global vaccinations against pertussis prevented approximately 687,000 deaths. On average, 1 to 3 deaths occur in Canada annually. Pertussis affects people of all ages and does not discriminate. Therefore, it is our job as healthcare professionals to ensure optimal protection against this disease. With the increase in pertussis and the recorded outbreaks in 4 health regions in Saskatchewan in 2016, there is a need for increased vaccination rates to meet the recommendations from the World Health Organization. The expected rate of vaccination is between 92 to 94% to prevent outbreak. However, as of September 2017, the coverage rate in Saskatchewan was only between 76.1 to 77.4%. What does pertussis look like? It appears very similar to the common cold. Symptoms often include sneezing, runny nose, mild fever, and a mild cough. The cough becomes progressively worse over 2 weeks and is often heard as whooping in children. Complications are often seen in infants and include apnea, pneumonia, convulsions or seizures, and encephalopathy. Those not receiving treatment may be contagious for up to 3 weeks after the cough starts. The mode of transmission for pertussis is droplet, making it a very contagious disease. Early diagnosis and treatment is important to stop the disease from spreading. Currently in Saskatchewan, those receiving the TDAP vaccination include new mothers in the postpartum unit, pregnant women at a minimum of 26 weeks gestation at a public health center, caregivers are those in close contact with newborns from a public health center, and babies are eligible to begin their vaccination series at 2 months, with follow-up vaccinations at 4, 6, and 18 months. Additionally, children require 1 booster at 4 to 6 years of age and a second booster in grade 8. This creates a barrier as those who do not have access to a public health center prior to coming into contact with babies, or those who have not received the vaccination, are creating a risk for infection and spread of the disease. Each time the healthcare system requires individuals to have an additional step in accessing healthcare, we are creating the possibility of care not being delivered. The need for immediate attention is further supported by an increase in reported cases of pertussis from 48 in 2011 to 213 in 2015. Pertussis continues to be a major cause of morbidity and mortality worldwide and is an extreme public health concern. Typically, epidemic cycles occur every 2 to 5 years since the introduction of an effective vaccine against pertussis. With the increased rates of pertussis in Saskatchewan in the last 5 years, and the fatality pertussis has on infants, we think it is important that vaccinations are more accessible in the postpartum ward. Having vaccinations available in the postpartum ward for all immediate caregivers can increase herd immunity and decrease the risk of infants contracting pertussis. Efficacy of acellular pertussis vaccine following primary series is estimated to be about 95%, and approximately 90% following booster immunizations. Having that immunization available directly in the postpartum ward can ensure those who do not have a mode of transportation have access to the vaccine, and that the newborn is protected from those around prior to the baby receiving the initial vaccinations at 2 months. Creating a policy on the postpartum ward will allow others to be eligible for the TDAP vaccinations and will affect nursing staff by creating new positions for public health nurses. Further, this can decrease the workload and stress of postpartum nurses, allowing them to focus on their delivery of patient care. Having a designated nurse for all vaccines will allow for a thorough education and consistency in the administration of the vaccinations. Allowing this can decrease the appointments at public health centers, which can create more opportunities for infants to get routine vaccinations and allow for public health nurses to focus on population health promotion in our community. Practicing in accordance to the principles of primary health care, we must increase the accessibility of the TDAP vaccination and implement a policy that supports the increase in vaccination administration to those caring for and surrounding infants. Along with the principles of primary health care, having the TDAP vaccination available for all immediate caregivers encompasses the principle of public participation. In collaboration with public health nurses, we can ensure that there is a certified vaccination position established that would be eligible to provide vaccinations to caregivers that do not have an order written by a physician, such as a father or grandparent of the newborn baby. This program would be in communication with the pharmacy at Royal University Hospital to ensure that there is a proper storage system to keep the preload vaccinations, as there will need to be more available within the hospital. To observe the success of this program, the administration rates of those with pertussis into the hospital would decrease, thereby creating more space for those with other healthcare concerns to be seen faster. Additionally, there would be an increase in the vaccination rates published by the Saskatchewan Health Ministry next year. The immediate effects would include awareness of the need for vaccinations against pertussis, the rates and consequences of pertussis. This awareness and education will enhance the quality of care given to patients in our health region. We interviewed public health nurse Cheryl Bolt and postpartum nurse Darcy Sparks to hear their opinion on this policy change.
Absolutely, I think it would be. I think, especially with our demographics of our patients, we have a lot of immigrant families that have just newly immigrated here. They don't have a way to get to public health, so often we're doing the teaching for them and telling them the importance, but I can't be certain of that follow up. Many of them don't have vehicles. They don't even have vehicles to get to their doctor's appointments lots of times. So I definitely think it would be beneficial in knowing that we're actually reaching all family members within the household, considering the outbreaks.
I do. I think that anything that we can do that makes it more convenient for people to receive vaccines will increase our immunization rates. And so, for many people, it's not that they're against getting the vaccine, but if they have to put extra effort into finding out if they need it or have to actually travel somewhere or make an appointment, it seems to be a barrier, and often they don't receive it. So I think anything we can do to increase their access and make it easier for them would probably increase our immunization rates. So right now, as a public health nurse, part of our postnatal assessment is to ask the parents whether they've received the vaccine either during the pregnancy or in hospital or the last 5 years. So part of my job is, if they don't know the answer to that, I need to look it up in our computer database. And so sometimes that involves looking it up and phoning them back, letting them know. So that's an extra step. Then we invite them to our clinics. And so they do add to the people who are attending our clinics. So in times where our clinics are backed up, whether that's drop-in clinics or appointment basis, where we do seem to be having sometimes difficulty getting people in for appointments in a timely fashion, as the healthcare system experiences cutbacks, and our population grows, we have more people to immunize. And so if we didn't need to provide that immunization in our clinics, it would free up space for us to give routine childhood immunization. So I would see it would have a positive impact, certainly on our clinic wait times. And I believe that it would increase our coverage rates.
Yeah, it'll definitely impact what we do, because we'll have more people to give it to, and there'll be, as I said, kind of the paperwork side of it and how that goes to public health to make sure that it gets entered into their system and that we have a record of it. So it definitely would impact. However, I would say that on the postpartum unit, what we strive for is family-centered care. And so if that's what we're always striving for, then if we were to actually include the whole family and make sure that everybody's immunized, that would be one step further in my mind to be giving family-centered maternity care, because this is something that's very important during an outbreak. And so, yeah, changes the role, and also the role of sort of workload related, but it's for the benefit of the family, definitely.
With the increasing need for the Tdap vaccination, we believe this policy could have a positive impact on the health region. Aside from the increasing immunization rates and decreasing outbreaks in the province, this program would support the primary health care principles by increasing accessibility and promoting family-centered care.